Endoscopic sinus surgery is intended to open up the small natural openings to the sinuses. Often these openings can become blocked by chronic inflammation or chronic infection or masses such as nasal polyps. Sinus surgery is usually done as an outpatient with the patient under a general anesthesia, meaning they're completely asleep and they go home the same day. I use a high-definition 4K video system through the nostril to have a very good picture of what I'm doing inside the nasal cavity. In my other hand, I hold several other instruments that are designed to make those small natural openings to the sinuses larger by removing non-structural bone and soft tissue that has blocked that sinus. This then allows me to clean out the disease or the infection inside the sinus, and by making the opening so much larger, after surgery, when the patient does their saltwater sinus irrigations, it actually will penetrate into the sinus and help wash out the infection. For many cases, especially complex or revision sinus surgery, I use something called image guidance. This is kind of like a GPS for your car that acts as a road map. I take the patient's own CT scan of their sinuses, I load it into a special machine in my operating room, and it tracks the tip of my instrument while I'm doing sinus surgery. It allows me to do a safer and much more thorough surgery. Most patients have only mild discomfort after sinus surgery. Usually they can manage the pain by alternating Tylenol and Advil every 3 hours for a few days. On occasion they do need 1 or 2 narcotic pain pills, but this is generally limited. Patients do experience a bloody nose for the first couple days. Rarely is bleeding significant. I don't pack the nose, and so patients wake up from surgery breathing much better than when they went asleep before the surgery. Patients do have a moderate amount of fatigue for the first week or 2 after surgery. And because of that, as well as the bloody nose, patients usually will take 3 to 5 days off of their work or normal activities. I do have my patients start irrigating the first day after sinus surgery. Most of them actually enjoy it. It makes them feel better. More importantly though, it helps speed up their recovery. It washes out old debris and blood and crust and scabs that can form after sinus surgery. 2 weeks after the surgery, they come back and see me in clinic. I do a nice thorough job numbing up the inside of their nose and then use small instruments to clean out any scabs or crusting that could still be there. These can lead to scar tissue, so it is important to have this done after sinus surgery. Most patients feel a lot better once they leave my office. Fortunately, complications with sinus surgery are uncommon when performed by someone experienced in sinus surgery. I encourage you to discuss this with me or with your sinus surgeon before having sinus surgery. Most patients who have sinus surgery are very happy that they had it done. They have much fewer days of suffering from sinus infections. When they do get an infection, it's usually easier to treat. They have fewer days on antibiotics, they're more productive at work, and miss fewer days at work. For me, it is truly a privilege to be able to take care of these patients. It is very rewarding to know that I've contributed to my patients feeling better and having a more productive and happier life.